We are live on Facebook and we are live on Zoom. Thank you everyone for joining us tonight for part 2. This is Betsy Torres at the Office of Continuing Professional Education. I just want to make a few announcements. Tonight's webinar is not a continuing education program. It does not provide continuing education credit. If you have any questions for the panelists, please enter it in the Q&A box and indicate if it's for the entire panel or a specific panelist member. If you want to have a conversation or just chat, you can also submit, your conversational pieces in the chat. We will be monitoring both areas. And now I'd like to turn it over to Dr. Madonna. Dr. Madonna.
Thank you, Betsy, and welcome from the Office of Continuing Professional Education at SUNY College of Optometry. We are pleased to have you join us for the second of our series on race and optometry. Our first webinar, which reached over 4,000 people, highlighted the experiences of Black optometrists from their time as optometry students to their prominent role in the profession today. Tonight, we would like to explore solutions to problems which were identified in that first webinar. We have put together a group of preeminent optometric educators, administrators, and leaders for tonight's discussion. It's my honor to introduce our co-moderators, who were panelists in the first webinar. The first is Dr. Joy Harewood. Dr. Harewood is currently attending optometrist at Bronx Healthcare System and an adjunct assistant clinical professor at SUNY College of Optometry. The second is Dr. Cheryl Reynolds, Chief of Advanced Ophthalmic Care at Nova Southeastern College of Optometry and President of the National Optometric Association. With that, I will hand it over to Drs. Harewood and Reynolds. Have a good evening, everybody.
Joy, you're muted.
Thank you to Dr. Madonna and thank you to Betsy. I'm very excited for this panel to get started and would like to start by introducing some of our panelists. First, I'm very proud to introduce Dr. John Flanagan, Dean Flanagan actually. He is the Dean of UC Berkeley School of Optometry, which is my alma mater, go Bears. And he's also the current president of the Association of Schools and Colleges of Optometry, better known as Asco. I'm also extremely pleased to introduce Dr. David Heath, who is the current president of SUNY College of Optometry, another one of my alma maters. And he too has served as Asco president, and Dr. Heath also served as a founding member of the board of directors of the American Board of Optometry in 2009 to 20. So, Dr. Reynolds?
Yeah, so I'm going to take an opportunity to welcome on the panel Dr. Ruth Shoughay. Dr. Shoughay is a graduate of Pennsylvania College of Optometry, currently known now as Salus University, where she is an assistant professor. Dr. Shoughay is also part of ASCO's diversity committee, and she will be chairing that committee as we go forward. And she has a master's in this area of diversity, inclusion, and equity. So I want to thank Dr. Shoughay for being on this panel today. And of course, the next panelist is a mentor, a friend, and a giant in the field of optometry, Dr. Ed Marshall. He has many accomplishments that I won't even mention. There's so many, and we're so proud to have him. He is the founding chair of the Minority Health Advisory Committee of Indiana State Department of Health and vice chair of Indiana Public Health Institute. He has served as chair of the National Commission on Vision and Health, chair of the executive board and vice president of the American Public Health Association, and chair of the nation's Health Editorial Advisory Committee. And I'm so proud to have him because he's also past president of the National Optometric Association. So thank you, Dr. Shoughay and Dr. Marshall, for being on the panel with us today.
I think we want to start just by talking about some definitions, piggybacking on our last panel, so that we can kind of situate the discussion. And I think Dr. Shoughay, you had a few a few things to kind of just explain so we can set the tone for our conversation.
Yes, thank you, Dr. Harewood. So what was discussed at the last panel was people's experiences, and that really began the journey of awareness, right? And so the next step when we're doing diversity, equity, inclusion work is to build on the awareness, build knowledge, and build skills. Part of that knowledge building is really understanding the terms that we're using. So when we say diversity, equity, and inclusion, what does that mean? When we say cultural competency, what does that mean? And so I think most people are familiar with diversity in terms of you just have a variety of people from different backgrounds, whether it's racial, ethnic, linguistic backgrounds, different lifestyles, things of that nature. And so that's what diversity brings to the table. Then you get into the equity piece. Equity is, are we serving the needs of the people who when we're talking in an optometric setting, are we serving the needs of our students? Are we serving the needs of our faculty based on what they need? So not necessarily equality when we're giving everybody exactly the same thing and expecting everybody to thrive in exactly the same way. Sometimes the resources need to be distributed based on need. So that's really equity and making sure everybody has a proportionate access to the resources. And then we have inclusion, meaning are all of those variety of voices that are present, do they have a seat at the table? Do they have the ability to really be included in the decision making, be included in contributing to the environment in which they're in? So again, when we're thinking about optometric education, we're thinking about our students. Is there inclusion? We're thinking about our faculty and our staff. Is there inclusion across the board when we look at the diversity of a school or college of optometry? And then of course we want to translate all of this into patient care, because at the end of the day, that's what matters. How are we taking care of our patients, and are we well equipped to do so? And that's where the cultural competency piece comes in, where we spend a lot of time with our students making sure they're clinically competent, but we also want to make sure that they have the skills needed to understand the differences in culture, understanding their own culture, first of all, and being able to navigate that in the exam room. When we get to cultural humility, that's an acknowledgement that this is a lifelong process. This is something that we have to continue to reframe and be at the forefront of our brains when we're taking care of people, and just being humble in that walk as we interact with our peers, as we interact with administration, as we interact with our patients and take care of them. So those are just a few of the terms initially we want to bear in mind when we're thinking about these conversations.
Thank you, Dr. Shoughay, and I'm so glad that you brought that up as far as defining the terms, because I'm pretty sure a lot of the participants had some questions about these terms that we're talking about: implicit bias, unconscious bias. And it's not new to optometry, our profession, and I know that we're talking about race in optometry currently, but for the NOA, and as president of the NOA, we've been in existence for over 50 years, and so I want to tap into where we have been as far as some of the things that we have done in the optometric profession to address diversity, inclusion, and equity. And one of the giants in the field is Dr. Ed Marshall, and I know he has a longstanding history of working in this area. So Dr. Marshall, if you can just give us a recap of what we have done, what has worked, and some of the things that we can tap into today to address this very issue that seems to be, again, raising its head because of this longstanding pandemic of systemic racism. So Dr. Ed Marshall.
It is appalling to think that it took over 300 years for the souls of the masses of this great nation to be touched by the social concern that is so prevalent today. That statement I wrote 50 years ago in a publication entitled Social Indifference or Blatant Ignorance, talking about the problems around lack of representation of minorities within the profession of optometry. It's unfortunate that that statement is still relevant today, 50 years later. As a part of that paper, I did a survey during the 1970-71 academic year of the schools of optometry that existed at that time. There were 12 schools, And part of that survey, I found that 8 out of the 12 schools had, at least they claimed they had a minority recruitment program. 2 said they saw no need for such a program, and 1 did not respond. 5 of the 12 schools said they offered financial assistance in support of their program. So we can go back to at least 1971 to see some evidence of activity within the schools and colleges of optometry around minority recruitment. A year before that, the AOA and the NOA, and the NOA, as Cheryl said, was founded in 1969. One of its prime purposes was the recruitment of African-American students. Well, in 1971, the AOA and the NOA received some funds from the National Urban Coalition to do a recruitment project. That project was lasted, I think, 15 months. The year thereafter, 1972, the NOA was successful in receiving a federal grant to launch its project to increase minority optometric manpower. That project lasted for 8 years, between 1972 and 1980. During that period of time, 345 minority students were recruited through the assistance of that project. That project also contained several other elements of besides recruitment. Each year, prior to the start of the academic year, all new entering minority students were invited to Chicago for a weekend of orientation paid for by the project. This opportunity provided the students a chance to meet other students like them, to interact with minority faculty, and to develop a sense of collegiality, camaraderie, and a sense of belonging, at least knowing that there's others out there who look like them, talk like them, acted like them, coming into the profession of optometry. That project also provided quarterly visits by regional directors to each of the schools of optometry, again, to interact with the students as follow-up, but also to interact with the administration, to talk about what was happening at the school, how the NOA could facilitate improvements in their programs, how it could help assist students as they move through their 4 years. And then every year at the NOA convention, the deans were invited to come and essentially talk about what they were doing in their respective institutions, kind of a sense of accountability. Also during that period of time, we saw the emergence of a federal program called the Special Health Career Opportunity Grant Program. Many of the schools, I think SUNY, Indiana, PCO, to mention a few, had summer programs where they would invite students to come in to learn about their profession. In Indiana, we had such a program that lasted for 17 years. It was titled the Indiana Summer Institute in the Health-Related Professions. Each year, I had to defend that title because the funders wanted me to change the title to optometry, which I refused to do. And the reason I did that is because I felt that if I limited to optometry, I would not get the number of students I needed to come in to have an effective outcome. So as you might expect, many of the students who came to that program came in with interest in medicine, dentistry, or some other health profession. But over the course of 6 weeks, attending programs housed in the School of Optometry, taught by optometry faculty, interacting with optometry students as counselors and advisors, many of those students actually now were introduced to optometry and essentially made the decision to think of optometry as a viable career option. And many of those entered optometry, not all in Indiana, but other schools as well. Fast forward to 2004, Asco developed its roadmap to diversity in optometric education and the profession. And this roadmap, the preamble of this roadmap was essentially to create, foster, and maintain an institutional climate that welcomes and embraces diversity. Following up on that roadmap, VistaCon hosted a meeting in Jacksonville of the newly formed Asco Diversity Task Force with representatives from Asco, AOA, the NOA, NOSA. This was in 2005. That meeting led to the 2005-2006 Asco Diversity Action Plan. There were several features of that plan, but mainly to incorporate diversity and cultural competency into the mission, goals, and objectives of Asco institutions. I haven't really checked to see how many institutions have that in their mission and objectives, but it needs to be bold and it needs to be visible so that potential students can see that and feel that it's a place where they might want to be. Also, to develop also part of that plan was the development of a cultural competency curriculum. That led to the cultural competency committee, which ultimately produced the Asco guidelines on cultural competency. So that's kind of a quick overview of where we were and where we are now.
Thank you very much, Dr. Marshall. Now, Dr. Heath, Dr. Flanagan, Dr. Shoughay, if you can all speak to maybe some initiatives that have been done at your respective schools and what has worked and what maybe has not worked as well as you would like. If you can maybe start with Dr. Heath.
Okay, thank you very much, Dr. Harewood. You know, certainly at SUNY, and actually before I talk about SUNY, you know, at some point we probably should also just talk a little bit about what ASCO is as an organization. What are their powers? What are their authorities? But in terms of SUNY, I mean, certainly as long as I've been at the college, which is now 13 years, you know, since we did a review of our mission, goals, objectives, and developed strategic plans, diversity has been a part, you know, of the mission statement and of our strategic planning process. You know, I think I would speak for a number of deans and presidents around the country that, you know, I think that people have been trying to do perhaps more than people know. You know, we haven't necessarily been as successful perhaps as we should be at making known what our efforts are and how we are doing with them. You know, and so certainly, you know, we actually, as Dr. Marshall mentioned, you know, on a state basis, you know, we have had a grant for a number of years, certainly a couple of decades, where we have been doing summer program and looking at orienting minority students to optometry and just like you, Dr. Marshall, health professions more broadly, kind of mixing in those who may have interest in medicine, dentistry, and so on. And we've gone through several major modifications since I joined the college. You know, and I think we've had some success on the diversity side as, you know, this year we have 16 underrepresented minorities, 8 African American and 6 Latino, but it's a fairly recent success rate, and it just that actually creates new questions and new challenges in and of itself. But we do have a diversity and inclusion committee, you know, and certainly, particularly given the current issues around the murder of George Floyd. You know, we've developed actually President's Task Force on equity and race and equity. So there have been a number of efforts, number of occasions. The grants that we've received has allowed us to give some additional access to resources and support for our students. But as I would say, I think we also have a long way to go. We have some challenges, I think, with inclusion, with faculty, diversity, and with mentoring. You know, and so we're seeking solutions, and I'm hoping certainly tonight's conversation contributes to that.
Thank you, Dr. Heath. Could you speak to why you think maybe some of them have not worked as well as you would have wanted them to?
Well, you know, I think, well, certainly the first focus, I think, is very much on the recruitment and the diversity side of the equation. And I think it's very easy to forget or not be as attentive as needed to the issue of inclusion. You know, so in terms of really establishing a culture of inclusion, you know, and certainly, actually, I would just share that I think part of the conversations we've had on campus recently, much like our first conversation webinar, you know, was about stories and people's experiences. And I think it helped to really sort of illuminate a different perspective. You know, Dr. Shoughay talked about cultural humility. You know, and I think these kinds of inflection points in history sort of force you to perhaps listen better than you may have in the past. So I think some of the challenges are just sheer mass. I mean, we now have enough of a critical mass that the voices are being heard. You know, I think for many of the campuses, when you have one or two African Americans or one or two Latino, your response is different, or the way you sort of get to diversity and inclusion may be different than if you have a larger number like some campuses in the country. So I don't know that there's a one size fits all. And again, I hope that's part of our conversation, is that I think the challenge for programs that have very small numbers are very different than ones that have a moderate amount, or those who have been more successful. I don't know if that really answers your question, Dr. Harewood, but I do think critical mass in finding a voice in numbers, you know, getting to that critical mass has been a huge challenge for us.
And I think having this conversation, Dr. Heath, is the first step. I mean, our first conversation, our first webinar that we did in race and optometry was another big step to have this very hard conversation that is so needed at this time. Dr. Flanagan is president of Asco. I know that last time during our meeting, and I was privy to that, you know, Asco's numbers are what we use. You know, we look at the data on schools and their admittance of diversity and minority. Those numbers matter, right? And so the real meat and potato of this discussion is that when you look at African-American enrollment in our schools and colleges of optometry, over the whole 50 years since the NOA has started, Dr. Flanagan, those numbers maybe have not risen as, you know, as we wanted them to, with all of our efforts. And as Dr. Marshall commented on what he had done prior to helping, you know, bring the numbers up, we see sometimes the numbers go down or the numbers go up, but it stays a little flat. So if you can just talk to us about Asco's role, what Asco's role is, and also to kind of touch on the difference between Asco and the ACOE when it comes to our schools and colleges of optometry, Dr. Flanagan.
Yes, thank you. And thank you again for the invitation to be on this panel. I feel greatly honored, and it's a real honor to be here. So I think what's fascinating in what you said is, as you say, I mean, NOA has been fighting this cause for 50 years. And if we look at the numbers, and one of the really great roles and responsibilities of ASCO is collating those numbers and making them publicly available. But if you look at the definition of underrepresented groups over the years, of course that changes. And if you look at trends in the way in which recruitment into optometry and the profession of optometry have changed, it's quite dramatic in some ways over that same period of time. You know, we're about to become majority women in the profession, and that trend was, you know, over many years, but now, you know, as I say, we're within a few years of majority. If we look at American Asian students, increased dramatically over the last 20 years. And if we look now at Latinx students, although they're still an underrepresented group, they have clearly increased over the last few years. But as you say, our Black students have really stayed very, very similar, this sort of 3% level for a long time, 2% of the profession, which is you know, we've got to do something. So is there an opportunity at this moment in time when everybody is focused on this problem? You know, can we make the most of this time to actually achieve a breakthrough, particularly for recruitment of Black students? ASCO is an organization representing the academic leadership of the country, with the mission to advancing optometric education and research to enhance the health and well-being of the public. So, you know, ASCO represents all the schools and colleges. Its board is made up of the deans and presidents. We're sort of lucky in a way that we're small enough as a group that every school and college is represented on the board. And we're now very proud to have you, Cheryl, as president of the NOA, as liaison to that board. But we also offer an organization by which administrators, residents, students, different organization admissions teams, and now we have a special interest group for the last few years on diversity and cultural competency. So it allows those groups to get together and form policy and work with the schools. But there's no big stick. We have no power over the schools. We have influence as an organization, but we're not a group that could lay down the law that every school has to follow. So then we have the ACOE, the Accreditation Council on Optometric Education, and that's our accrediting body. So that's recognized by the US Department of Education and the Council of Higher Education accreditation. So they do the job for optometry of accrediting our programs as we try and move forward. Now that's very different because within that accreditation are powers of the schools have to do certain things to maintain accreditation. So I think it's important to distinguish those two. We know that from the last for our recent conversations plus the first part of this panel, there's some confusion as to where those powers may be. But what has Asco been doing on a national level? I think the most important thing that Asco's been doing is our pipeline initiative, the Optometry Gives Me Life. That was a major initiative launched a couple of years ago. Asco's pouring in around $1.5 million a year into that program. It's two reasons really. One, that our applicant pool is small for the size of our profession. We need to attract more young people into optometry. And a really important part of this campaign has always been the diversity part of it. So it's aimed at our STEM students. So as the agency we employ for that keeps telling us, if we see the adverts, then it's doing the wrong thing. And if we do see the campaign and it doesn't seem to speak to us, then it's probably doing the right thing in that it's trying to speak to a different generation. There are 3 videos associated with that, and I would certainly recommend people to go and have a look at these. There's 3 optometrists that are featured. One African-American man, a Latinx woman, and a woman who's part-time educator, part-time clinician, part-time farmer who has an interesting background. Anyway, that campaign is a major part and is starting to show some signs of improvement. I know there was, I think it was something like a 15% increase in underrepresented groups applying for optometry this year that we associate largely with that campaign. And if anyone's into statistics, there's something like 64 million hits in a year on that campaign. We're looking for it to double the applicant pool and increase diversity at the same time. So that's Asco's major effort. We also really try and partner with NOA on various initiatives. In particular, our Diversity and Cultural Competency Committee. So, for example, one of the things that committee's been doing, and this is the committee that Ruth is about to start chairing, that committee is responsible, along with the Academy and NOA, for the symposium on diversity in optometry that is happening at the Academy. Whether the Academy is live or remote, that symposium is still happening and will be a very dynamic symposium. So I think there's a fair amount of activity on the national stage. We need to do more. Should I go on and talk about some of the Berkeley initiatives, or we'll perhaps go over to Ruth and I can always come back?
Let's have Dr. Shoughay give us a little bit about what has been done, what initiatives you're working on yourself.
Okay, so I'll talk about what's being done at PCO. And for over 37 years, we had a summer enrichment program, which was a 6-week immersive on-campus program targeted at underrepresented minority students. And the program has not been in operation for 5 years now. Part of it was loss of funding, so having to find new funding and really show the evidence that this program worked and it was worthwhile and worth putting money into. So that was supposed to relaunch this summer, COVID-19. No need to say any more than that. So the plans are to bring it back next summer, so June 2021, to reinitiate that program. It'll have a different twist because it's going to be a little bit more modern and feature both on campus as well as remote educational opportunities. So that had been a big part of the Pennsylvania College of Optometry's way of really helping with recruitment of underrepresented minorities, particularly Black students. And that is something that we feel is vital to bring back. We're in the process of hiring our first diversity, equity, inclusion special advisor to the president. We're literally interviewing this week. And so it's very exciting. And we just, through there, we have a committee there. I'm on that committee as well, and discovered the work that is required to be successful needs to go beyond what perhaps volunteer committee people can do. So we're very excited to hire this new person whenever we complete our interviews and the search committee makes the recommendation to our president, Dr. Middleman. So that's going to be a big one for us as well. And then of course, within the committee, we're doing things such as lunch and learns. We had our first one last month. This month, we have our planned one for the next 2 months, and do that monthly, and it's open to our students, our faculty, and our staff. And again, to just continue in that knowledge path, continue into skill building, and fostering a way for people to learn about each other. The person that you're sitting next to, you have no idea about, and really wanting to foster that camaraderie within our university setting, not just the College of Optometry, but the Salus University as a whole. So that's been a recent initiative that we've been very excited about. And we had a great turnout for the first one earlier this month, and hoping to see that continued success. On the Asco side of things, we had a cultural competency workshop for a few years that almost every school had the opportunity to get. And so a few of the committee members on the DCCC committee, the Diversity Cultural Competency Committee, would go to the schools. So these would be on-site trainings for the faculty. And again, most schools, except for maybe 2 or 3, completed the workshop. What we're in the process of doing now is revamping those workshops, because we have to think about DEI work as not just a one-off. I did this one workshop, I attended this one webinar, so I'm good. I know everything I need to know about DEI. And it's really to establish some longevity in creating initiatives at the individual schools. And by doing that, each school needs to be able to identify at least one person that can make sure these initiatives are being carried out. So we're going to definitely be looking towards the DEI SIG and the members of that SIG to help be the anchors at the different schools to make sure, one, we're doing these workshops and they're getting done, and that we can continue these conversations and the learning and the building as people go on.
Thank you,
I
Dr.
actually
Shoughay.
wouldn't mind asking my co-moderator, who is also, a pillar in the field, about some of the initiatives that the NOA is doing or the NOA has done and how we can expand upon it, what it's worth.
Well, as I said, as president of the NOA, and this organization has been around for 50 years, we have our student organization. One of our biggest initiatives is our scholarship for our students, recruitment and retention of our students into our schools and colleges of optometry. As Dr. Marshall says, we have our regional trustee engage the schools and the students. Of course, we offer scholarship. And as part of the solution that we'll discuss later, we recognize, and I want to thank Dr. Adam Ramsey and Dr. Daryl Glover in the first conversation, because they really opened up the door for this conversation, was addressing the HBCUs, right? So one of the things that we recognize when we look at awareness about the profession, knowledge about the profession, that some of our HBCUs, our students aren't aware of what optometry is. And so we all here tonight, the participants, the panelists, we have to do a better job in increasing awareness about this profession. And the NOA is proud to partner with the Post and Family Advice Foundation and VSP Global in providing financial assistance, which is also one of the barriers to some of our HBC students to get to schools and colleges of optometry. And as Dr. Flanagan said, we'll discuss a little bit more in the solution, partnering to address the call to action that was brought up, 13% initiative, and some of the other issues that were brought to the forefront that we can help to address and make sure that there's a long-term commitment to these issues. I mean, one of the things that we recognize is that although we've been here for over 50 years, advancing the visual health of Black and Brown individuals, we still have a lot of work to do. NOA recognizes that, and we want to partner with our schools. I've had great conversation with deans of schools and to work in partnership to increase diversity, and not just diversity, that's the buzzword, but inclusion and equity in the schools and colleges of optometry. So we have some ideas, and I'll touch on them in the end, but just some of the things that the NOA has been doing. But I want to tap into something that Dr. Flanagan brought up. We talked about Asco, we talked about the ACOE, and one of the issues that was brought up in the first conversation was, why isn't there a need for a school, or wasn't there a school for optometry at a HBCU? So I want to touch on that because Dr. Marshall has some historical perspective, because I think we need to know what we've done so that we can know what worked and what we can try again. And I think it's a great idea as we look at what schools and colleges as we open. So Dr. Marshall, if you want to comment on what we have done to look at maybe having a school in association with an HBCU that's focused on optometry, can you mention that or talk about that?
From my recollection, there were some sidebar conversations around the possibility of maybe establishing a school at an HBCU. These conversations were pretty much informal, and they basically ended at conversations. For various reasons, it was not pursued any further. But I think it's important maybe to think about, if we had a school today, if all of a sudden we can snap our fingers and a school materialize, would we have the students to fill those seats? And I think, when I think about solutions to problems, I always try to think in terms of structure, process, and outcomes. And I think of a school as a structure with the desired outcome of being obviously producing optometry students. And if we have a school at HBCU, the outcome would be producing African-American optometrists. But do we have the processes in play, or will we have the processes in play to, number one, generate the applicant pool, to provide the types of education and training with appropriate resources to put those students through those 4 years at that HBCU? So I think, I'm not speaking against it, but I'm thinking that we need to think that the school itself is not a sine qua non of the solution. We have to think larger than that. It's a complex issue. a school would be great, but we also have to have all those other things, all those other pieces to go with a school to make it a successful school. I would hate to see us move forward, have a school, and that school does not succeed. I would want it to succeed, but we need to make sure we have everything in place to do that. But to get back to your question, yeah, there were discussions. They were informal discussions, and they basically ended as informal discussions. But I would like to mention something that follow up on something Dr. Flanagan said about the changing underrepresentation within the profession. Sure, we have seen increases within the female population. We've seen increases within the Asian population. We have seen increases, although more modest, within the Latinx population. We have not seen similar increases within the African American population. Underrepresentation has now become kind of a catch-all and in a way kind of a cop-out, because we can show underrepresentation increases, but we cannot show African American increases. We need to kind of refocus, maybe retune, and make sure that we're talking about African American students, because those are the ones where we have not done well at all. The data are there. We don't need any more research. We don't need committees to rehash things. They have things that there have been programs that have worked. We need to look at those and see why do they work and how can we best reproduce those. Funding understood. That should not necessarily be a long-term barrier. So I'm hopeful that out of this discussion, we would kind of maybe shed that underrepresentation sort of model and begin to focus on the real voids within the profession, which happens to be African Americans.
If I could just jump in for a moment, because I was on a call, or I was speaking with somebody from Asco trying to get some more recent numbers, and part of it was also related to the initiative, the applicant pool initiative of Asco, to give people a real sense of what kind of a challenge we're talking about. And I don't know what it was 3 years ago, or 2 years ago, but a year ago, if I remember my numbers correctly, and don't hold me to it 100%, there were only about 119 African American applicants nationwide to schools and colleges of optometry. Now this year, that jumped up to 140. It's about a 17 or 18% increase. And so, sort of as I've shared with some of my folks, the good news is that we see some increase coming from this initiative. The bad news is the number is still really, really low. So if you're talking about 140 applicants across the entire United States, that's a very low bar. And I think the question, as you've alluded to, how do we really get increased awareness? How do we make? Because I know we've connected with, or at least had approached and worked with the HBCUs a bit, but how do you really kind of get them embracing a profession that they don't know about?
That's a very good question. I want to just comment on that, because that has been the, and I see there's a question in the chat box about HBCUs, what other things need to be in place in order to have a successful program at optometry program at HBCU. So Dr. Marshall, I know I'm tapping into you a bit, but your program at Indiana that you ran for so many years, one of the things that you repeatedly say about a successful program is commitment, consistency, commitment, consistency. And can you tap into that a little bit for the audience? Because I think that is what's not known, is it's not just mentioned in HBCU. And I know that the Black Eye Care Perspective, Dr. Ramsey and Dr. Glover, they have their Impact HBCU initiative as well. And our gnosis students are working on their HBCU initiative as well. And the NOAs, and we're all working together to address that. But it's going to take just not mentioning or going to HBCU, it's work. And if you can just comment on that, Dr. Marshall.
Thank you. Yes, it has to, whatever we do, it has to be sustained over time. And one of the reasons I think my summer program was successful in Indiana was that we built relationships with individuals at the HBCUs. We built relationships with advisors, with counselors, with professors, because and then they then became the face of us on site every day. If we could convince them that optometry was a viable profession for their students, they can then carry that message forward. One of the things we also did was that we invited advisors and counselors to Bloomington, to our campus, so they could see firsthand what optometry was all about in terms of the educational process. That experience, I think, served us well, just like this experience of bringing in a student who wants to go into medicine or nursing or dentistry, having them exposed to a school, to students, to faculty, and then learn that maybe, yes, this is possible, a possible career for me. But you just can't hop in, say, optometry is good, and then leave. It has to be sustained. It has to be relationship based, because you have to have that reinforcement over time. So I think going to HBCUs, I went to my first ACU to talk about optometry was in 1969, I think, or 70. Mel Shipp and I, Dean Mel Shipp and I, he was in Dean then. But we took our spring breaks. We borrowed a car from the university and drove through the Southeast on our spring breaks, talking to students at HBCUs about optometry. Unfortunately, we were not able to sustain that effort at that time. I was able to do a better job of that with the Summer Institute program. So I think as we go forward and we begin to work with HBCUs, we need to make sure that we identify individuals at those respective institutions who can be our face there on a continual basis, build that relationship over time, and hopefully then that will begin to bear some fruit in terms of students coming in. It got to the point at the end, towards the end of my program, I didn't have to recruit. I had individuals at HBCUs sending me students, begging me to take students. But it took a while to get to that level of familiarity and trust.
Can I put this question to anybody on the panel? Because I think Dr. Marshall brings a very big and important point up. It's that there are these inflection points where we are all interested, and maybe there's more resources in terms of time, maybe in terms of even a little bit of money, into increasing diversity and inclusion and belonging. But what do we plan to do in order to keep this going? As leaders in your particular areas or in your schools, what do you plan to do to try to keep the fire burning, so to speak?
If I can jump in here, I think there are some exciting initiatives that are starting, and I think that I'm hoping that sustainability really comes out of sustained partnerships with NOA, Black Eye Care Perspectives. As Dr. Marshall said, we know the numbers, we know the problems. But it's finding creative solutions, and as you say, that they need to be sustainable. So, what sort of things are exciting me that have come up over these last few weeks and months? There's one idea, this virtual pre-optometry club that Black Eye Care Perspectives have started, and their social media campaign that's so savvy, that's attracting people to be interested. How does it go from just being an interest, being an outreach, that can get to people who aren't in established campuses that have pre-optometry clubs that are organized and that we can work with or have always worked with? How do we reach out to those students who have a new interest and don't have that traditional support of, say, a pre-optometry club? What we just sort of we piloted with Dr. Glover from Black Eye Care Perspective, where he brought a student from that group who was interested in applying, and we sat down with the student affairs team to mentor that student as to how to best prepare their application. So I know that if, as Asco, we went out to every one of the 23 schools have professionals working on their admissions who would absolutely give of their time to help in such a structured way. I mean, that was one, I thought, really great outreach that was new and came from that group. That's the sort of thing that if we can keep on partnering with NOA and groups like that to sustain it. And for mentorship, you know, if just as big a worry is if we're successful with the pipeline, we start recruiting more students, we have to be able to give them the support. And it's the mentorship and support. And certainly we're, I think, along with a lot of other schools, between us, we don't have enough faculty from underrepresented groups. And to provide that support, we're going to lean very heavily on our alumni and organizations like NOA. And I know, I can't believe the level of outreach that's happened. You know, the people are really willing to help. And I hope that's a way we can make it sustainable and make it inclusive once we have any success.
Dr. Heath, I have a question from the chat box for you, because you asked about this originally with partnering with the HBCUs, and I know SUNY has done that. And one of the questions was, can you develop a long-term partnership? So one of the things that the NOA has done, and we're pleased to have done this, is through our HBCU initiative, is to create a matriculation agreement with Hampton University and Salus University. So we're very pleased that we have done that, and that work is part of our HBCU initiative. So those students in Hampton that are interested in optometry, the pipeline will be to Salus University. And so you're right there in the East Coast where there's a lot of HBCUs. And the question is, can you develop a 7-year program or a long-term program with the HBCU in your area? Or, you know, that you've worked with in the past, Hampton, we'd love to do Hampton or Howard to be that pipeline. And is SUNY committed to that?
We've made the overture. Well, we've made the overtures, you know, about the 3-4, 7-year program. And right now, off the top of my head, I can't remember with which HBCU. But actually, you know, this is, I think, this is a great conversation. Because I think when, one of the things about Asco is we're sort of a federation of competitors, and so you end up with everybody's admissions offices trying to do one better, or create a unique relationship. The initiative that John is talking about with NOA and with Black Eye Care Perspectives, talks more at looking at the level of the industry, the optometric education industry, and how do you create a partnership that basically rises all boats, and so each individual campus can try to create those relationships and can create programs, and that's fine. But I think a lot of the sustainability may be more powerful at a national and organizational level, because my student affairs, director of student affairs, could decide to go be director of student affairs somewhere else, 3 years from now, and that's one relationship, and you can certainly sustain it as an institution, but it's often a little bit contingent upon one or two personalities. So I guess what I'm thinking of when you think about organizations, ASCO doesn't have power over, the institutions, can't force the institutions to do anything, but there are certainly projects like the Applicant Pool Project where it's to all of our benefits to be collaborative in nature. So even developing the relationship with the HBCUs may have a core. I mean, it may be a more powerful strategy to basically involve all institutions in developing the relationship, and then let the individual relationships funnel from that. So is it individual schools that sustain it, or is it the national organizations and the partnerships with organizations, like NOA, that keep those going? We have found that when we do 3-4 programs, once we have that relationship, they kind of go on forever unless you go and revisit it. But what you see is you get ups and downs depending upon personalities and relationship in terms of how many students are actually fed from that institution. So I'm kind of looking at this and taking, that conversation about partnerships in the HBCUs and saying there are strategies at the macro level, but, and then there's also strategies at the campus level and then at the individual level. And I think you have to do all three.
I think this feeds perfectly actually into a question that we got in the chat regarding where to start. And somebody commented about us reaching out to high schools, middle schools, and other places like that in order to increase awareness about optometry. Does anyone have any initiatives or any thoughts on how we can do that, or whether or not we should do that? Maybe Dr. Shoughay?
Yeah, I think it's definitely important to start the mentoring of young individuals at an early age, because if we wait until they're in college, we're now not only, as Dr. Heath said, we're trying to work in a united way, but we are competitors with each other. If we are waiting until college, we're all fighting for the same pool of students. And that pool isn't getting any bigger, one. Two, we're also competing with medical school, pharmacy school, dentistry school, and all the other STEM programs that would also like to increase their African American, their Black applicants. So we really have to take a long-term view. And when I say long-term, I'm talking about 10, 20 years when we're in the middle schools and talking to kids about optometry. And that is where our optometrists that are practicing out in their communities, we need all hands on deck for this. I can establish something at my school where we're out doing high school reaching, and we could pair that with our school screenings that we do. Every time we go into a public school to do a screening, we pair that with some educational opportunities. That's definitely something we can do. But again, those kids may be seeing us once a year. Where is that continued conversation? And so we need our optometrists that are out in the field, so to speak, creating those connections as well and maintaining them. Because if they see you as an optometrist, that has a far greater impact than, maybe this virtual program that we do, or we come to the school once a year and talk about it. We have to sustain those relationships, and we really need all hands on deck to move these efforts forward. And there are people that are out that are doing that. We just need more people to do that because it's such a big project. One of my good friends, she has a STEM program for women, and it's called SCORE. It's for young girls. And she's actively talking to recruiting, and it's for all STEM programs, but she's at the helm, and she's an optometrist, and they see this, Black intelligent woman optometrist, and that will have a far greater impact than maybe a one-time showing up at their school. So it requires a lot of effort and all hands on deck.
I would agree with that. Data have indicated that when we think about STEM, third grade is kind of the crucial time period. It's where students begin to kind of separate themselves along those science thoughts about science. When we started my summer program, for the first 6 years, we had two programs. We had the college program, which was 6 weeks in length. We also had a high school program, which was 2 weeks in length. And we ran those programs sequentially. And we gave up on the high school primarily because we had difficulty tracking those students after they left our program. Now, that does not mean it was not successful. What we did not know was how many of those students ultimately made career decisions that as a product of that exposure. And with a federally supported program, we had to show outcomes, and we weren't able to do that effectively. But I would agree, yes, the HBCUs is kind of maybe a first step, but we need to go much deeper. into the academic progression and get down into the middle school level, because students begin to form ideas early on, and if they're going to prepare themselves adequately, they need to have those long-term goals and objectives and begin to think about what it's going to take to be successful as a health professional.
I'd love to follow up on that from what both Dr. Shoughay and Dr. Marshall were saying there. The community responsibility, no matter what poll you look at, the leading cause for people applying for optometry and matriculating into optometry programs is contact with their own optometrist as a younger person. And we mustn't underestimate that power. And that also allows us to get to some of the younger people too. You know, if you know, being able to talk to those students at that age when they come in and see you as patients is absolutely vital.
I agree. Thank you, Dr. Flanagan, Dr. Marshall, for mentioning that. Now, you know, as we go into the last hour of this discussion, we can't not discuss not just the HBCUs, but the schools and colleges of optometry and the issue of lack of diversity within the schools and colleges of optometry, specifically when it comes to African-American faculty members. I know we've had a long conversation, Dr. Flanagan, and with Asco, and I know there are some comments in the chat box in regards to faculty. I know for the NOA, after our first conversation, even meeting with our NOSA students, the biggest issue is mentorship. As I said, for me being on faculty at Nova Southeast University, I had an awesome mentor in Dr. Terrence Ingraham. But I think we need to talk about that a little bit. And I would challenge Dr. Heath to kind of comment on the dean's responsibilities to making sure that their faculty is diverse and fully representative of the patient population so that our students feel inclusive. I think that's part is where the inclusion part of diversity inclusion is a little bit missing. And then I'll challenge Dr. Flanagan to talk about ASCO's role in making sure that our faculty at our schools and colleges are diverse. So I'll start with Dr. Heath.
Okay, and we've had some conversations, and you know, right now, certainly at least within my own institution, that whole issue of the development of the student, the mentoring, particularly when you don't have a diverse faculty, is one of the great challenges. But I think one of the things that, and this may or may not be true, and any one of you may want to disagree with me, you know, I think it's been very easy to assume, because students who make it through college do it very well, successfully apply and get into optometry programs. I think there's often assumption about their own resourcefulness and their own ability to take initiative and to manage their own career paths. I mean, I think we all try to make resources available, but I don't know whether we have a history of proactively engaging students, particularly underrepresented minority students, to talk to them about the opportunities that are available in academic optometry. And certainly I've been having some very recent conversations with some of our underrepresented minority students, and a good number of them, have a real interest in potentially pursuing an academic career until they hear about the salary, and then things, often sort of go down a little bit. But I think, one of the challenges is that, and I think, it gets back into some of the terminology that Dr. Shoughay was really talking about. And that some of it is yes, the cultural humility concept, but it's also the idea that we really, until you start hearing the stories, you don't necessarily fully appreciate the degree with which people, and from an equity standpoint, need different resources to achieve in their own career paths. And so I think a lot of the challenge here is intentionality, in terms of engaging early on. And one of the, in the chat box, one of the comments, mentioned Dr. Vishwanathan had mentioned the future faculty programs of Asco. And even suggested, could you do that kind of a program even for college students, trying to identify and cultivate, future leaders, even going back into the college ranks. But some of this is, I think we do need to try to identify and understand what the needs of these students are who have an interest in this path. The question I've asked, Dr. Reynolds at times is, also how do we make our non-minority faculty much more effective, in terms of creating an inclusive environment in reaching out to encourage and facilitate African-American students and others, who may be interested in that career path. I don't know if that answered your question.
I know we had a long discussion, the NOA met with you, and I know that part of that is true, and we talked about cultural, competency and diversity training for faculty and some of the challenges that may be. But I think when we talk about faculty or just having a representation at the schools and colleges, it's not just faculty. I think Dr. Shoughay had a great term. You have to change the rules. I think, Ruth, you were talking about that, Dr. Shoughay. And if you want to comment on that, it's not just a faculty member. It could be a minority recruitment officer who looks like the students that are at the school. So not just faculty is what we're challenging the schools to understand, that these students want someone there that kind of to be their advocate for them.
To be honest, we've got both African-American and Latinx senior managers, middle managers. I think when it really comes to the student experience, and I don't want to it's got to be the whole culture, I agree. But I think when it really comes to career paths and feeling included in the intellectual environment of the institution, the responsibility is, yes, senior leadership, but it is also the faculty as a whole making those connections with the students.
Dr. Flanagan, for you at Berkeley and as for Asco, that is the big question. Some of the questions in the chat box is how can we, and I know that Black Eye Care Perspective, I want to thank Adam and Dr. Adam Ramsey and Dr. Daryl Glover again. Something similar to the Rooney rule for football. We could call it the mentorship rule for optometry. And I know you and I discussed that again, and our challenge is to adhere to that. If you want to comment on that, please.
Yeah, no, we've talked a lot about this, and I think they've decided on calling it the equity rule, but I sort of like the mentorship rule, to be honest. The idea that we're all responsible for making sure that there is always Black applicants interviewed for any job. Now, like anything, it's never as simple as that. There has to be a pool for any given job, and making sure that we develop, mentor, give every opportunity for people to have the confidence to go for jobs at every level is incredibly important. So again, it's inclusion and it's mentorship. So I think that Asco needs to concentrate on offering future faculty training. We've got programs on that. We need to target some of those. We've got mentorship programs going on, but the pipeline needs to keep going. So how do we get more Black faculty? And an obvious area to initially really concentrate on is the residency programs. Mm-hmm. The fastest track to faculty for most of our institutions is residency. So ensuring that we start really encouraging and mentoring Black students who we get into our programs to consider residency, mentoring them as residents about what a faculty career could be like, just as you've talked about your own experience, Dr. Reynolds, and how important that is. So, you know, that's really I think that's one of the areas we need to focus on. And the other thing is, I mean, at Berkeley, we've had it's been a real joy over the last really just 10 years, and particularly the last 5 years, in the demand through the FQHCs for optometry clinics. And in the Bay Area, we now have clinics in 9 FQHCs, the federally qualified health clinics. You know, being in those communities again gives visibility to optometry, and again, I think that's another area that can be helpful in eventually in recruiting and offering those opportunities.
And as you mentioned a little bit earlier, Dr. Reynolds, about changing the rules, it is so important to nurture the relationships we have with our students, talk to them about the options that they have as an optometrist, and what an academic career can look like. Because I feel a lot of people just don't know. But in addition to recruiting from our resident pool of applicants, but also thinking about who else can come to educate the students that are Black. You know, does the person who teaches biochem and genetics have to be an optometrist? Nah, no. You know, so I think looking at other PhD options, especially if you're in a city that has a lot of schools. I'm in Philadelphia. We have so many schools, graduate schools, and looking to them as resources for faculty opportunities as well, I think is going to be important in helping to diversify our faculty body. And just to pivot just a little bit, I'm not sure if we're off this topic, but I was seeing some things about getting other optometric organizations involved in these initiatives, which again, harkening back to the all hands on deck, there's no room for silence here from anyone. And silence is deafening and sends a message. And we all need to be eyes open, ears open, mouth open, hands ready. And we're not seeing that across the board from everyone. So I wouldn't mind chatting about that if anybody else wouldn't mind chatting about that a bit.
No, I think that brings up a great point, particularly harkening back to some things that you had said regarding training our current faculty or making allies out of people who are already in the schools, even if we don't have that type of representation. So I know there's been a lot of conversation about training, right? Diversity training and how do we do that and putting these trainings on. So two-part question. What type of diversity or new diversity initiatives in terms of training our current faculty and students are we working on? And what type of metrics are we using to see if those things are working? I open it up to anybody who would like to tackle that.
Well, you know, can I come back to numbers? Because, you know, we mustn't lose sight. You know, we talked about there's been an increase, 140 applicants. Even if we double that in a year, if we're incredibly successful, we get 280 applicants next year, it's still not enough to get us where we need to be. Similarly on the residents, what I was saying about residents, the hard fact is there was only 12 Black residents this last year, something like that in the country. So 12 out of 400, you know, where are we going wrong there too? So again, it's about conversations, about mentorship, it's about recruitment and making sure people have the opportunities. So, you know, the magnitude of the problem is stark when we start looking at the numbers. So we've just really got to
looking at those. You know, let me jump in, because I mean, looking at those, you're right. The numbers are critical. Accountability is a part of this discussion. And certainly, you know, I know my institution, I think most institutions, but certainly Asco, has a lot of data that they compile on an annual basis. But what is the question that's being answered? Is it data collection for data purposes, or is it data collection to answer a question? And so part of the conversation does have to be, Dr. Howard, has to be about what are those key metrics? What are the ones that show value? I mean, certainly counting numbers, is certainly easy in its reflection of expanding diversity. But there's so much more to that. We do have numbers on minority faculty across the country, but how are those shared more broadly in public? How are those presented, and what are the comparisons that are put in? How do you measure a sense of inclusion, or a feeling of belonging on the part of your students on campus? And there are many instruments out there to do it. The question is, which one is the right one to use, and what are the benchmarks that you want to compare to? But I also wanted to touch base, because in terms of thinking about diversity of faculty, I mean, I do think a partner or a potential partner in this really could be the American Academy of Optometry. Mm-hmm. Because for faculty at all the schools and colleges, the academy is sort of the intellectual playground. I mean, it's where people get together and share and collaborate and exchange ideas. I frankly don't know, if they have any I know we're running programs there, but I don't know if they have programs specifically to try to create a sense of inclusion or a sense of community among the underrepresented minority groups. And Dr. Reynolds, you look like you want to say something.
Yeah, so the Academy, Barbara Cafferty and I, we've had long conversation as the NOA president, and I'm proud to say that the Academy recognizes some of the issue, and they have formed a diversity task force. And our past president, Dr. Cynthia Hurd, is working with some of the awesome people at Academy to address some of those issues. And for me, we currently have someone on the membership committee that is focused on diversity and increasing diversity and awareness about the Academy fellowship and the academic component of that. So there are some steps that they are doing, and I'm proud to say that the NOA has partnered with them. But I wanted to segue back a little bit to, there are a couple of questions that I wanted to bring up, some from the chat box. So Nova Southeast University, where I'm proud to be a faculty member. I graduated from Nova Southeast University, College of Optometry, 1996, although I look very young. And I was on faculty. I did a residency at Nova Southeast University, and I did a private practice and then came back on faculty and have been there for over 20 years or so. But the question is, we have one of the highest number of Black students at Nova Southeastern. And what I would say is that being there for so long and having such a great mentorship is so critically important. Also, too, where Nova Southeastern is in South Florida, there's a large, diverse population, yeah? And so we have a large Afro-Caribbean population, we have a large Hispanic population. In fact, Nova Southeastern is a minority institution. And so I think for us being in that area, for me being at the school when it first started, and for me being there over the years, I know what the impact has been of my presence as a minority faculty member in helping to increase residency amongst my students that are now doctors of optometry, and also to mentor the young students that are currently in the program. And we're proud to have a very diverse faculty. So I can't leave this conversation without underscoring the importance of having a diverse faculty. We could talk about it and say we can't find that. There are awesome students. There's loan forgiveness program when we talk about salaries. If you go into education, you can get your loan forgiven. I know someone brought that up in the chat box, and I'm so appreciative of that. Just mentoring these students to become residents. A lot of times, a key thing is if they don't feel inclusive at the school, I think Andre mentioned this at the last town hall, they don't want to come back. You just want to get their degree and then leave the school. So it starts with being in the school, being inclusive, being part of the process that these students may want to do a residency at that program or think about a residency afterwards. So we go back to what we've said so many times. It starts in the schools, and we would love for all the schools. We're challenging all the schools. The NOA is challenging all the schools to accept the challenge to increase diversity within their faculty, and it can be done. So I want to thank Dr. Shoughay also too for bringing up the silence of some of our optometric organization. Our patient population is so diverse. Our patient population is who we serve, and we serve a very diverse population. And I would hope that the American Optometric Association, the AOA, and other great organizations are not silent on this very important topic. Part of the reason we're having this conversation is not because George Floyd, Breonna Taylor, or Ahmaud Arbery, and so many died, is that we can't breathe. We haven't been able to breathe. And so it's really a very passionate thing for me, because what their death represent is that we've had a knee on our necks for so long, and it's time to speak up and speak out. And I think Dr. Ruth Shoughay said we have to act now. So I want to thank you, Ruth, for that, because I think silence is not the option right now. We need to be part of that. If we really care about the patient population that we serve, the AOA needs to be part of this. So I challenge anyone that's from the AOA listening to be part of this very important conversation. Okay, I'm done.
And I agree 150%. You know, I also want to touch upon other things that Dr. Shoughay had said regarding diversity and inclusion, regarding training. But one thing that kind of strikes me is that there are so many different pieces to this puzzle that we need to put together. It's a large, long-range, long-term issue that requires quite a bit of time, likely full-time. And, you know, all of us here, it's great to have this conversation, but our full-time job is taking care of patients for the most part. So is there any thought or any overtures towards maybe considering bringing somebody on who has trained full-time to do these type of things in admission, in recruitment, in the diversity space, in order to do that in the individual schools or at Asco, or in general, just have a full-time position answerable to the very top brass on how we move forward and how we do this. Anybody?
No, well, you know, I mean, I look at my own student affairs, and my director of admissions is Dominican, you know, the VP is Latino, we've got a, you know, Hispanic registrar, you know, and so, you know, I mean, having people of color doesn't necessarily always make it more powerful or less powerful. It helps. But, you know, I've contemplated at times what is critical mass, and one of the things I do need to highlight is we've got 23 schools and we got 23 different scenarios. You know, there are programs now, you know, mine is unique. I'm a public university with my own campus. There's no other institution quite like it. You've got some privates. You've got privates, you know, that are part of larger health sciences campuses, and you got public universities. You got colleges of optometry like Dr. Flanagan's. You know, this is part of a larger university and shares resources in many cases. And so it doesn't have a large, you know, set of employees or a lot of necessarily flexibility in simply creating within those colleges. So you always have to look at the local context in terms of what you can or cannot do. But I would put out that I do think one person can't do it. You know, Dr. Reynolds cannot, you know, be responsible for all of Nova Southeastern, and Dr. Shoughay can't be responsible for all of Salis. You know, it really takes a critical mass. And I guess the question becomes, you know, part of it is how do you form, identify, and incentivize that critical mass to move towards these goals? I mean, I think it's one thing, yes, the president can say something, a dean can say something, we can certainly make it our priorities, but we also need people on campus who take it up as their priority as well. And they need to be rewarded for doing it.
So in terms of trying to have somebody, I think what we're trying to say is that, you know, not one person is going to be designated to do this, but if our main job is not to do this, this is something that we're interested in, we're trying to do as part of our entire, you know, list of other things to do. Is there a way to have somebody on the outside, somebody else who helps put all these pieces together, like a diversity consultant or
Well,
somebody who
I mean,
tries.
that's where ASCO could play a role, and I believe can. Dr. Shoughay and Dr. Reynolds have been involved with the DCCC, where a few years back, in partnership with NOA, we proposed having a full-time ASCO person responsible. I think at that time we called them the Diversity and Opportunity Director or something like that. And basically we could never get it funded. You know, that's an expensive, for a small association, that's an expensive position. And we prioritized the Optometry Gives Me Life. But we are exploring how we might once again get that person. We've got some funding for a consultant to really look at what that person would be and should do, and how they could help all of the schools and help them the national picture. And again, critically doing that in partnership with NOA. This was always a joint NOA initiative. So I think there's still hope. I personally think that's a really good idea, and would like to see that happen. But I think that I think there are possibilities that we might be able to make that happen.
Could I ask a question of the panel? And Ed, you know, you may be able to, looking back on your experiences. So to all of you, what would you need to see, or how would you say in 5 or 10 years that, gee, the schools and colleges have been successful on their diversity, equity, and inclusion initiatives? I mean, how did you measure success? Was it sheerly just only the numbers of matriculants?
No, obviously, numbers are a key metric, but we also, looked at things like campus climate, interviews, exit interviews with individuals, interviews with students, how they felt about their presence, in the institution. And I think, it's important because their perceptions obviously become their reality. And, I want to kind of link this back to the whole issue of implicit bias and cultural competency. Sometimes what we say is not what's heard. And what we try to get across may be misinterpreted because we're not looking through the lens of the individual who's on the receiving end. And that impacts climate, impacts one's comfort level with their respective institutions. So we have to kind of, numbers are key. But when we talk about that inclusion piece, the inclusion piece is, how do I feel like I'm welcomed? Do I feel like I'm really belong here? Now, I also might add, diversity plus inclusion does not necessarily equal equity. They are related, but they are 3 separate entities, and we have to make sure that we are equitable in terms of making sure resources are available so that all students will have an equal opportunity. Faculty relate to that very, very directly, because if I'm a majority student and I have all majority faculty, I have a certain level of comfort that other than the minority student who does not have that same feeling of comfort because there's a lack of minority faculty. There's no one to go to and talk to when things are a little bit gloomy, or they feel they have enough trust to go and talk to someone when things feel a little bit gloomy. So we have to kind of, think of faculty, we have to think of students, all those pieces of puzzle have to be in place in order to have a successful program 5, 10, 15 years out. The chicken and the egg, it's a constant chicken and egg argument. We can't get, in deference to Dr. Shoughay's comment about basic sciences faculty, sure, that's probably an immediate opportunity to go out and find faculty of color, African-American faculty in the basic sciences. and then use that as a stepping stone towards identifying faculty, well, increasing student enrollment in order to identify potential faculty, 5, 10 years out. So no, I think it's having those conversations with the students and making sure that they tell you the truth. A minority student may not feel comfortable in confiding in a non-minority individual for various reasons. So that trust factor, I think, is key, and trust comes with familiarity.
I agree wholeheartedly, Dr. Marshall. Building that trust, just like we talked about, you have to establish trust and relationships with HBCUs because they're not, you have to have a relationship. The same thing needs to be done for our students. And, I did a small focus group with some of my students, and the biggest things that came up was mentorship. And it goes back to every campus needs to have at least one person with boots on the ground. And the reason why, our summer enrichment program was so successful and we had so many Black students come through PCO, because of Robert Horn single-handedly, created that program, maintained that program, and had a relationship with every student that went through that program. And something that I'm trying to do, and I don't feel I've done it as successfully as he has, but it's something I'm certainly working towards. So that means, having an open door policy. And these days, open phone, open video chat, open text, policy. Students can reach me in a number of ways because I made the decision to be accessible. So accessibility, being trustworthy, and mentoring them is a key part in feeling like you belong in an environment. Does that necessarily have to come from a Black or Hispanic person? Some can make an argument, maybe not, but I think it's most helpful. And we call that concordance. We can make that same application when we're talking about taking care of our patients. Patients do better, and there's research that will, tell you this. Patients do better when there is concordance with their provider, either racially, ethnicity, linguistically. If there's some way that you have a shared experience, your patient is more likely to follow your treatment protocol, more likely to ask questions, and more likely to have better health outcomes. And we can apply that same thing to caring for our students. It goes hand in hand, caring for a student and caring for our patients. We're trying to, these whole conversations is about that. How do we best care for our students? How do we best care for our patients? And we have to remember that, and it's building trust, providing mentorship.
And I think I'd actually like to answer that question, Dr. Heath, myself, even though I'm going to take my moderator hat off for a moment. I think there's quantitative data, which will definitely indicate that there's more diversity. There's qualitative data that may help us measure whether people feel more included or there's more belonging. But for me, personally, I will feel like we've gotten there when I walk into a classroom to lecture, and I don't feel like the only one, and I don't feel like people are looking at me crazy because I look the way that I do. I will also feel included when I go to academy and I feel like maybe some of the lectures are representative of my minority community that I work in terms of teaching me how to manage that, or the people who are sitting there are representative of myself. So it's a feeling that you're not the only one, you're not the only chocolate, that the cookie has a lot of chocolate chips, which is what we're trying to do. And I think that will come from representation. It will come from teaching people who are already at the upper echelons of the profession how to mentor and include people who don't look like them. Because Dr. Shoughay, you're right, this is a 5-year, 10-year, 20-year plan. So we need to use our existing systems in order to include and to invite and to create the type of community that we are in this conversation to work towards. So moderator hat back on. Does anybody else have?
I want to comment on that. You know, would there be a point where we think that we've reached or attained diversity within our schools, inclusion and equity? It's an ongoing process, Dr. Heath. I know the NOA started 50 years ago. So again, one more time, the NOA started because, as Dr. C. Clayton Powell, the founder, said, taxation without representation. We weren't part of the process. You paid your membership dues to be part of the AOA, but you weren't fully participant as a member of the AOA. And so the NOA was started to give a voice, and not just to give a voice. You know, when we have our members do CE, as Dr. Harewood said, a lot of times you submit continuing education courses to the major meetings, and you're constantly rejected. And so the NOA was an opportunity for us to stand in front of our peers and to give CEs. Also, too, for our students to feel like they're not the only one, if they're the only one at the schools and colleges of optometry. Where I thought the NOA, and even for us, it's still work in progress. We did an amazing job when, you know, we had the funding, and I see comments in the chat box, this all is with funding and commitment and challenging the schools. But you know, as Dr. Shoughay said, Dr. Robert Horn was committed and dedicated and had support of PCO president and faculty, I would assume at that time. Dr. Marshall, you can comment too, you had support. You were getting not only the funding, but students came from as far as Mississippi to go to Indiana in the cold to be an optometrist. And so there was commitment there. I remember when I graduated, when I was in the school at Nova Southeastern, I remember PCO had almost 15 Black students. I was like, wow, how did you have so many Black students? And what we're seeing today, 2020, is almost like we're back to 1969. Like we're starting over again. And so we need that continuous growth. And I know we're taking steps now, but we need to sustain those steps. I challenge Academy is doing a great job. They have their diversity task force, but we want to be able to be included in Academy when it comes to the leadership and the different, you know, I didn't even know how you volunteered for Academy until recently. So there are things that I'm learning. Also, too, with Asco, I think being part of the Deans and President's Council, thank you, Dr. Flanagan, is an opportunity to hear what we can do to help increase diversity and to hold the schools accountable. And I think working with Asco, we have to do that. I mean, it's not just the NOA's responsibility. I like what Adam said. It's not my job to make you, you know, to tell you what we're going through. It's your job to help us as well. And all of us are in this together. All of us are in this together. I see in the panel that the students, you know, one of the things the NOA did when this started, the conversation around race and racial injustice with the death of George Floyd, we had a town hall to hear what our students were feeling and to tell you that was an emotional town hall. I think I cried to hear what the students in 2020 are experiencing at their various schools. And since they're talking up and seeing what they're experiencing, I think we need to address that. We can't say, oh, we can't find faculty. We're telling you that they want faculty that are diverse at their schools. And so I challenge all of the deans that are listening, all of the individuals at schools, to make that commitment to bringing in the diverse faculty, because the students are yearning for that. And I don't know what the success will look like. It's be a continuum because we're still working on this, and there's no one-stop answer. We got to just continue to work on this together.
Let me answer that. Let me answer the question about when will we know?
Yeah.
A different way. We will know when we eliminate racial and ethnic disparities in eye and vision care. We have to remember that diversity is a quality of care issue. We've talked about the fact that it improves access, it improves patient choice, satisfaction, communication, compliance. It also, according to the Institute of Medicine, it also improves the experiences of all students during the educational process. Mm-hmm. So it relates directly to the quality of the care that we are being trained to provide. So when we eliminate racial and ethnic disparities, primarily because of an increased diverse workforce, we may not be there, but we would probably be very, very close to achieving that goal.
I was going to say something along the same lines, Dr. Marshall. I think we achieve success when we no longer have to have these conversations because this is nothing new. This is nothing new. You know, if in 20 years, I hope I'm retired by then, but maybe not, that I have to be on another webinar this time, you know, if I have to do another one of these in my lifetime, it will feel like a failure. And that to me is success, that we have to not just have 2020 vision hindsight. You know, everybody likes to say, well, hindsight is 2020 because we can see the error of our ways. We have decades of seeing the error of our ways. So we have to have 2020 foresight and move to the future of what we want the optometric industry to look like. And it can't be up to any one person. It really can't. You know, and I think the different schools that have that one person are very lucky because it is a lot of work. But we have to be able to think forward and be committed to this for the long haul. It is a commitment. We're not going to make dramatic change in 5 years. We can make very substantial incremental change in the next 5, 10, 15 years for sure. I think if we can move from having 140 to 200 Black applicants in the next 2 years, I think that's achievable. Why do I think that's achievable? Because that's literally a little more than one person per state to go from 140 to 200. That's what we're talking about. If everybody can reach out to a handful of Black students, whether they be in middle school, high school, college, and out of that handful, one or two apply to optometry school, we've met that very specific benchmark of getting to 200. So I think there, you know, it feels sometimes impossible. It really does. But I think we can break it up into smaller bits, and with efforts from everybody, optometry schools, Asco, NOA, ARVO, AOA, all the A's, all the OA's, you know, in the industry, VSP, Esler, Johnson & Johnson, everybody, nobody is excluded from being helpful. You know, it's like, oh, there's too many cooks in the kitchen. No, we need more cooks in the kitchen for this, because I don't want to have the same conversation in 20 years from now. I really don't. And for me, that's a true measure of success if we can move on to other things.
I would like to say that perhaps together we can help get some of these issues on AOA's agenda. Certainly ASCO have attempted in the years I've been involved in ASCO, which is the last 5-6 years, to engage AOA on issues of recruitment and diversity without much luck, to be perfectly honest. So, you know, perhaps together we can persuade all the organizations to take these agendas seriously.
I would say, you know, part of what you want to ask is what feels different. Because Dr. Shoughay, I agree with you. I mean, I don't think anybody, and unfortunately, you know, after you know, I've got, you know, a fairly long career behind me. Often you see the same issues coming around again and again and again. And this is one, but there are others within the profession, other issues within the profession that also cycle. What feels a little different to me this time, and it makes me a bit hopeful, you know, is that there's more discussion of inter-organizational collaboration going on, you know, partnership at the national level. And that doesn't, the schools have their own individual responsibilities and have to be a big part of the solution. But in terms of making this a visible and sustainable initiative, keeping it in the forefront of our national organizations, you know, I think is imperative if it's not going to slip down. You know, Ed, I don't know what you're experiencing. You know, if you go back to the 70s and 80s, you know, a lot of what you were talking about were governmental grants, you know, mostly secured by ASCO institutions. You know, in your history, you know, have you seen much collaborative efforts between organizations like Academy and NOAA and Asco and AOA on the issue of diversity?
Not a lot, not what it should be. What I did see though, when the schools had those grants, there was collaboration among the grantees. If I had students in my program who wanted to go into optometry, but not necessarily at IU, you know, I would call a Bob Horn or Gerald Simon or someone else and say, hey, I have this student, can I send them your way? So we kind of worked together collaboratively. You know, even though we were somewhat in competition, our goal was to get students into the profession. Outside of that, not a lot between ASCO or AOA. I think the NOA has been the vanguard of this, you know, for 50 years. But again, NOA cannot do it alone. And as Ruth said, you know, this has to be a profession-wide, industry-wide, comprehensive effort. They're all hands on deck. And we have to be very, very careful too, because as we all join in and we all feel like we really want to contribute, we have to make sure that we are looking through it with the proper lens. Because sometimes we, in our eagerness to do the right thing, we may come off the wrong way by virtue of what we say or how we act or what we do. And we end up with unintended consequences of that effort. So as we're sitting there, as Ruth says, you know, in that kitchen cooking up this meal, we need to make sure that we all have the right recipe and the same recipe, so that we are speaking the same language and we understand what our words, what our body language really means in terms of being interpreted by someone who's looking at it through a lens different than the one that we have.
And I think that brings us to a very positive point. We are on the cusp of the class of 2024, which for all intents and purposes, from an optometric standpoint, is somewhat of a clean slate. So what, for this new class, can we do to create this type of environment immediately? I mean, there's long-term plans, but there's also short-term things. You know, as Dr. Shoughay said, Dr. Heath was talking about as well. What can we do and what are we planning to do to welcome this new class in order that they feel more included than maybe we did when we were in school? And I think that's any panel member.
Let me piggyback on something I said earlier that the NOA did when we had the project, when we had the orientation session. Now we've discovered Zoom. I think this is a great opportunity, a platform to invite these students into a Zoom meeting. So they feel that, hey, someone is looking at me. Someone appreciates the fact that I'm here, and have a dialogue among them with leaders within the profession and talk about what they can expect, what's ahead of them. I think that will at least start them off on the right path.
And let me just comment on that, Dr. Marshall. So the NOA is committed to that, and Zoom has opened up just a brand new way of communicating. And so we challenge all of our regional trustees, all of our members to meet with all the students, the new NOSA students, more virtually to hear their concerns. We're planning a town hall meeting part 2 to hear our NOSA students' concerns. Again, I challenge all the deans of the colleges, all of the administrators at the school, president, to listen to your students. I think that when you say what can be done, these students want to be heard and listening to them. And there's a difference in hearing them and really listening to them. If you hear their complaints and gripe, sometimes, oh, they're just complaining, but really listening and understanding that they don't feel fully inclusive at the school that they're going to. And that leads to the same old problem. They graduate, they leave, and they don't even become active alums, and they don't want to stay or engage this school. I know for a while, for me at Nova Southeastern, after I graduated, I wasn't an active alum as I could have been, and that changed. There were some issues when I was at Nova Southeastern, but after a few years and awesome mentors, like I said with Dr. Terrence Ingraham, it brought me around, and I started to donate and become a little bit more inclusive. And not just become inclusive as being a faculty member, but being a mentor. I can't stress that enough. You know, if you have a diverse, or if you don't even have a diverse faculty, you know, you don't have to have a mentor that looks like you. You just need a mentor that supports you, someone who's going to be there. I have awesome mentors that don't look like me. Dr. Joseph Pizzamenti, he's one of my awesome mentors, Dr. Stacy Coulter, and many more from Nova that I go to and call all the time that give me guidance and support. And I challenge the schools to be there for their students, their diverse students, and to hear them and to be their mentors. And so those are some of the things I think today, this conversation that we're having, I'm hoping that going forward, those schools implement. And I again challenge the schools to at least look at having a diverse faculty, if it's not this year, next year, for their faculty members, but not just having a diverse faculty. You may have one African-American faculty, but if they don't feel included in the process, if they don't feel welcome, they're not staying at that school. And that's a challenge. So it's not just having the faculty, it's making sure, as Dr. Marshall said, you have to have inclusion and you have to have equity. And I know it doesn't always equal the same when you have diversity. So we just got to work on that.
Back to the class of 2024. Thank you, Dr. Reynolds. I agree with all those points. Back to the class of 2024 as well. Does anyone have any other suggestions? I think this has been great. We can each take these suggestions back to our own schools. And we may have just created another Zoom seminar with the new students. Any other initiatives? Maybe Dr. Shoughay? Any
I don't know if I have another initiative, but I just wanted to comment on something that Dr. Reynolds just said. And this work is not just for Black people. So, you know, we've been talking a lot about Black people, Black students, Black faculty, this past hour and 51 minutes. But it's important, you know, as you said, some of your mentors are non-Black. Some of my mentors and some of my best mentors are not Black. They are white, and they have been really instrumental in my career. So, you know, if you're a white person in the audience, if you're a Chinese person, a Japanese, Indian, whatever, however you prefer to identify, if you are non-Black, you need to know this conversation is also for you. And there are ways that you can get involved. Simply listening to your student or your faculty peer, you know, if I go to you as a peer in distress, the most that you know, I want to feel heard, you know, and I've had to deal with situations where I had to find the person that heard me. And it took a little while, but when I found that person, it felt like this weight lifted off my shoulder. So I cannot tell you, I can't stress enough that you are also part of this conversation and these initiatives. Because again, these are big things that we're trying to accomplish here, and it requires all hands on deck. So be that mentor, be that person that reaches out, be that person that offers a listening ear. And if you have any kind of power in the system, be the person that creates the change. Because sometimes you need to be, what's the word, a sponsor. So it's not just, you know, a mentor or an advisor, but taking it to that next level where you're the sponsor and you are literally clearing the path to a new way. And we need you to do that. You know, I just want to shout out Dr. Flanagan and Dr. Zadnik in that they did that. I should not be, according to the rules for Asco, I should not be chair-elect for the DCC committee. Why is that? Because the Asco Exec Board makes up the chairs of the committee. Who is the Asco Exec Board? The Asco Exec Boards are the deans and presidents of the colleges and schools of optometry. Who makes up the deans and colleges and presidents of the schools and colleges of optometry? Okay, so they saw this need and they saw what was happening, because sometimes you just don't see until you are forced to see. And so they saw this and said, we need to create a new path because this is not okay. And sometimes you need to be that person. And it's not easy, it's not pretty, and it is often hard, but we're counting on you to be that person and be that sponsor, be that advocate, be that mentor, be the person that listens, because that could make all the difference. And you have no idea.
And the beauty is you can do that today. Now, I know we're getting to about 9 o'clock, so time's kind of running short. And I just really wanted to open it up to anybody who had anything else to say or to share that you think that would be useful to your counterparts across the country who are listening, or inspiring, just some words to end upon, because I think we've had, a lot of great ideas and just a really great panel. So I will start, Dr. Marshall. Anything to leave us with?
Yes, I would like to add a challenge to Dr. Reynolds' challenges. I would like to challenge all those successful optometrists out there who are listening to this, as well as those who are not listening, to give back to your school, to contribute to your school, to create scholarships at your school to help these students going forward. Because that's a need, that's something that we all need to do. We need to pay it back. In order to pay it forward. So that's my challenge.
And I want to add to what Dr. Marshall said. You can give it to your schools, but you can also give it to the NOA. The NOA has been around for over 50 years, advancing the visual health of Black and Brown individuals, and we give scholarships. And so, as Dr. Marshall said, pay it forward. We stand on the shoulders of giants that have come before us, that have paved the way for me to be the optometrist that I am today. We owe it to the next generation to pay it forward. We owe it to be mentors. We cannot, everyone on this panel, everyone in the audience, you can be mentors. You can help the next generation of those bright, talented optometrists to become the optometrists they dream of being and giving back to their communities. It takes all of us to be part of that effort. So I challenge everyone tonight. I'm leaving you with a lot of challenges to do that, to be that mentor, to be that one person that listens and hear the students, and also to be that trailblazer that makes changes, to make the changes that are necessary. Change is not always easy, but it's necessary. And right now, because of Ahmaud Arbery, George Floyd, Breonna Taylor, and so many others, we need to have change. So I leave that with that.
Dr. Heath, any last words? Anything to leave us with?
Well, I don't know. The last three comments were actually so good, and I love Dr. Shoughay's very direct in the camera, challenge to everybody watching, into all organizations, and of course, Dr. Reynolds, has always every conversation I've had with her, she's left me with at least a half a dozen challenges, So thank you, and thank you for joining us and bringing us the historical perspective. I'm kind of looking at this a little bit, from the SUNY perspective, because we sort of sponsored the conversation, but it's not about SUNY. It really is about a nationwide effort. And I'm just thrilled at the nature of the conversation and the breadth and some of the creative initiatives that I'm hearing. Because certainly I don't think any one of our institutions can do this on an individual basis. It really is going to take multiple voices. And I think everybody is adding to that. So, thank you. And I actually do want to point out, I know that there's a lot of people on Facebook too, but I actually want to thank everybody who took the time out of their evenings to tune in, listen, and the conversation has been going in the chat box, and thank everyone for your contributions. We have a lot of work to do.
And with that, Dr. Flanagan.
Yeah, I'd really love to give a shout out to October the 6th, the day at the historically Black colleges and universities that's being organized. Again, NOA and BEP, and that ASCO's there to support all our admissions teams. Everybody's there to support whatever can come out of those sort of initiatives. The virtual optometry clubs however it is we can get people interested, Black applicants into the schools, Asco's there to support and help. And we will then get our faculty. But I also just like to echo what Dr. Marshall said, resources are incredibly important. You know, we just had an initiative to double, we have this graduate opportunity program scholarship. It's the largest scholarship we give to incoming students that we target for students with need and who need support. And the faculty 2 years ago said we need to double the size of that. So we're up to 8 of those now. But, you know, all of those things require resources. And one of the things I've certainly learned is the resources that have gone into medical school programs for all these sort of initiatives over the last 20, 30 years. And I'm sure Dr. Marshall can tell us a long history of that, that we've never had access to. And I think we need to fight for those resources so that we can really help any of the new applicants that we can attract and help recruit faculty and retain faculty. That's going to be a future problem, hopefully, that we have to face. So.
And I have just the same thought that I had from the first panel, that there's so much energy, and there's so many good ideas. We have such a long historical perspective, and we have such a rich profession in terms of the ability to bring ideas together to many different problems. So I think if we don't succeed at this, it's because maybe we didn't put all of our heads together, we didn't try, because there's absolutely no way that we can't move forward with all these ideas in place. So with that, I would hand it back to Betsy if she'd like to say anything, or Dr. Heath, Dr. Donna.
Dr. Heath, if you have anything, I don't want to cut you off.
No, I think I already said it. I just, you know, my great
Okay.
appreciation of the panels and these conversations, and we may be continuing these conversations.
Yes, we will. I would like to first and foremost thank very much our audience for joining us tonight, but most importantly, our panelists who've taken the time to be the trailblazers, you know, from part 1 to part 2. We do foresee that there will be multiple parts to this, and even what I would like to see, a part where we see the change that we started and the change that we can hear and kind of start taking track of that. So I won't keep everyone too much, but again, thank you to our panelists, to SUNY, my office, for putting this program together, the college, and our part 1 panelists. Without them, we wouldn't be here today, and without you guys, we wouldn't be here today. Have a good night, everyone. Thank you for all who joined, and look out for more information on the CE office and our programs. Thank you.
Thank you.
Thank you. Good night.
Good night, all.
Good night. Bye-bye.